Good evening, everybody, and thank you for joining 108 Harley Street educational event. As it states, I'm Mahantesh Karoshi. I'm one of the consultant gynecologists based here. Today's theme is how COVID is affecting gynecology practice here and gynecology practice in other parts of my clinical work. I start by showing this slide, and it's very relevant, as you know, that it's not the strongest that survives, nor the intelligent that survives. It is the person who is able to adapt to the challenges and works cooperatively against common threats. So that is, for us, it is COVID. So the COVID effect made us slowly over time, over the last 9 to 10 months, has made us change our whole ethos, right from the way we behave in the public arena, public sector, way we deal with the patients, the communication challenges when you wear the mask. Patients don't know whether you're smiling or whether you're angry, whether you're sad. We also don't know what's their expression. So you can see the day-to-day challenges patients and doctors face. And then, for me, I do a small amount of private practice. When the COVID was first came into light, Boris Johnson, he shut down London, and that there were a few areas where the clinics were run, but then how do we know, how do the patients know that I'm doing the, my business is open? So the first thing I have to do is change the website landing page, because that's kind of gateway for me. So this is what I did. So, this itself, just changing the landing page, gave patient confidence that business is still open and they can still get in touch with me, my old patients, the new patients. And it clearly states that I'm available for telephone consultation, video consultation, and moreover, it's not just me, also the insurance company, the Bupa, the Vitality, the AXA PPP, within 2 weeks, they came up with statements saying they support their clients to see a specialist, consult a specialist at the same rate as before. So as I said, it's a change in whole ethos of clinical practice. Why is it not moving? The other thing I did for me was, when patients started contacting my private secretary, in order to cut short the whole consultation process, I needed to know more of patient problem. So rather than asking them, I created this very easy HIPAA compliant, which is equal to GDPR compliant form. So my secretary sends a patient a link, and patient fills the series of questions. The most important one is, what is the most bothersome symptoms? Have you seen any specialist before me? If the answer is yes, if you have any documents, please upload. So you can see this last year, this time, this was not existent. But again, quickly, within a few weeks, I could adapt to this kind of practice. This is my home setup, and you can see that my wife, my son says this is your Zoom room, and I find Zoom is actually very user-friendly. More than me, it is my patients who loved it, because not all patients are as tech savvy as other specialists. So whenever the choice was given by my secretary, they always choose Zoom, so I have no problem. And what my setup is showing is I've got two floodlights, but you may be seeing me a black shadow. This is not the perfect, virtual setup, but at my home, it's like a TV studio. Got 2 floodlights, and then a big computer on the background, and then my laptop, and then I've got a 3-dimensional model here. Because for me, as a specialist, educating my patients is the key. If I educate my patients, they feel what's the problem they're having and how I'm going to help them and how they're going to modify their lifestyle. So patient education is quite important for me. This is one of the 3-dimensional model. It is acrylic. It's made in Germany. I don't know whether you can see. It's 3-dimensional. It's made of acrylic. This is a normal uterus, normal tubes, and normal ovaries. So think of yourself. If you're a patient, I said this is normal, then the patient is more interested in finding out what's wrong with me. The next one is, now if I hold these 2, so imagine if she has a polyp, and I say this is where the problem you have, or she has a fibroid, this is where the problem you have, and that could be the reason why you're having problem in falling pregnant. So if you compare the normal versus abnormal, and I show the problem here, she herself is telling me, doctor, I want you to remove. So a few seconds, a good 3-dimensional model will get this going. In the traditional way, patient would be sitting in front of me. I'll be using same 3-dimensional models, but here it's more face-to-face. But alternative is to use the existing technology and make good use of it. So this is the 3-dimensional model, which shows the problems in the uterus. So that's adenomyosis. Those are polyps, and that is cancerous growth in the womb, and that is the submucous fibroid. If she's trying for pregnancy, or if she has heavy periods, that needs to come off. This one is intramural fibroid. Again, educating patient is important because not all fibroids need removal. And this one, the size matters. So I do tell patients that if the fibroid size is less than 7 centimeters, it doesn't need any intervention. So for example, this doesn't need any intervention. Again, you can use it in different ways. For example, here, the tube is damaged. So if I say you've got hydrosalpinx, she has no clue what I'm talking about. But if I show her this is how your tube is looking on ultrasound or MRI, like a sausage, and it is damaged. In order to make your pregnancy successful, one way is to remove this tube, damaged tube, because it's not going to help you anyway. So using 3-dimensional model, using 3-dimensional models to educate patients has a long way to go. So again, as I explained to you before, showing what is normal and then showing what is abnormal in her situation keeps patient interested and also take things seriously. Then, so imagine this scenario. I consulted a patient virtually, and I say you need certain type of medications to help control your heavy periods, or I say you need to take a week course of antibiotics. And because of COVID situation, most patients were asking me, doctor, is there any way you can arrange home delivery? And believe it or not, I found one, and it is a UK-based company called CloudRx, and they are based in Leeds, excuse me. And if I order tonight, or if I order by midday, my patient will get the medicines by tomorrow midday. But if I order at 6 p.m. now, the earliest you will get it is day after tomorrow. But the good thing is patient will get like a tracker notice. So she will get notified as soon as I order. She will get a link and she has to pay, and then she will be notified at every step. More importantly, I will get notified that your patient has been issued the medicines you prescribed. Because in the past at Harley Street, one of the challenges I used to have was some patients used to say that they never got the medicines. So I didn't know what happened to my prescription, but here it gets tracked. So that is one advantage. And the cost here for home delivery is £4.75 to £6.75. As I explained to you before, patient education. So the other thing is in some scenarios where I didn't have my models, so I use Screenshare. So Screenshare is available in Zoom, it is available in MS Teams, it's available in other virtual educational softwares. So I did the consultations, but some patients needed some procedures done. So those things we still have to do it in clinical areas. So what we do, so the procedures we did before the COVID and the procedures we did after the COVID or during the COVID remain the same. So we still do the procedures at 108 Harley Street as before. So we do perform hysteroscopy without anesthesia, hysteroscopy is under local anesthesia, and also if women have polyps in their womb, because we are surrounded by IVF clinics and we do provide independent polyp removal service. Unfortunately, the video is not working because I prepared on my Mac and I'm presenting on their rivals, which is Microsoft. Sorry about that. So what I'm showing here is different types of uterine polyps. Now the question is whether all the polyps need removal. The consensus is that polyps are abnormal growths, and if they are causing heavy bleeding, they need removal. If woman is trying for pregnancy and she's not achieving, they need removal. It's very rarely specialists say that polyps can be left alone. But again, there are few specialists who do wait and watch, but I don't believe in waiting and watching because invariably they cause either abnormal bleeding or abnormal discharge. Now, just quickly touch basing on the different types of polyps, different types of modalities to remove the polyps. What I'm showing here in my hand-drawn diagram is every polyp has a base, and depending on the technology used, whether the base is completely taken off or sometimes base can be left after removal of the polyp. So what are the procedures available to remove the polyp? The traditional method is to put patient to sleep and dilate the cervix and remove the polyp. And the traditional method involved electrical energy. And I'll show you in the next few slides why electrical energy should not be used in women who are trying for pregnancy. Unfortunately, this slide, the video is not working because of the conflict between Microsoft and Apple. So this is what we have at 108 Harley Street. So the one on your left is the traditional big telescope, histoscope. The outer diameter of the histoscope is 4 millimeters, but the modern one is 2 millimeters. The beauty of 2 millimeter histoscope is we don't need to dilate. Patients don't need any local anesthetic. They come in, no preparation needed. They can have their breakfast, they can have their lunch. All we do is make sure they're not pregnant. So we do the urine pregnancy test and we perform purely under vocal local. So that's quite good for the patient perspective. The other advance in science and technology has happened is the high resolution monitors. Because of high resolution monitors, we can get away with a miniature histoscope. And when you combine a miniature histoscope with high resolution monitor, I'm sorry about this, the video is not working. We can actually remove these polyps under local anesthetic rather than putting patients to sleep. And one on the left is the traditional monopolar resectoscope, where one has to dilate the cervix to 10 millimeters. One on your right is where you only need to dilate cervix to 5 millimeters. Because one of the problems when you dilate the cervix to 10 millimeters is it can cause cervical incompetence because of the injury. So if one is proficient in using modern technology, it's actually for the patient benefit. And also one on your left, which uses monopolar energy, can leave a scarring effect on the at the endometrial surface level, compared to the modern technology like TrueClear or MyoSure, where it uses pure mechanical energy to cut the polyp off. And by doing that, there's no scarring left with MyoSure and TrueClear. So that is the two representative pictures, which shows one on the left showing some scarring effect, one on the right, there's no scarring at all. So conditions which can be managed online. So a patient with pelvic pain, she doesn't need examination because good thorough history substantiated with either a detailed pelvic ultrasound scan or an MRI can easily clinch the diagnosis, such as endometriosis. Subfertility consultations. Most of the subfertility consultations can be done online. Hormonal profile testing, ultrasound scanning, semen analysis can be done just by arranging the consultation and planning the investigations. Early pregnancy issues. So when patients have early pregnancy problems, most of the time all they need is an ultrasound scan to demonstrate that their baby is doing fine, to demonstrate heartbeat activity, or to see cause for problems in early pregnancy, such as bleeding, such as subchorionic hematoma, which can be easily picked up on ultrasound scan, or patients with menopausal issues such as hot flushes or vaginal dryness. Again, a decision can be taken without examination, a prescription for hormone replacement therapy or non-hormonal interventions. Conditions which patients need to attend face-to-face consultations. So these are the patients, they can have virtual consultation to start off, and then following ultrasound or MRI, they will be advised to attend a clinic, because if she has a big fibroid, as a surgeon, I need to know how am I going to open her abdomen. Does she need a transverse cut or does she need a vertical up and down cut? So these patients will be asked to attend the clinic. Or patients with recurrent vaginal discharge problem, so they will need genital infection screen, or they may need a HPV screening. So these patients will be asked to attend. Or patients who feel that something coming down, or a cyst or a swelling around the genital introitus, so they need to be assessed by face-to-face. And because of the sensitive nature, it's not possible to use virtual consultation in such scenarios. For patients who need hysteroscopy or insertion of contraceptive device, such as copper coil or a Mirena, they need to attend the clinic. Or patient with suspected herpes genitalis, she also need to attend to confirm the diagnosis. I just quickly touch base about vaginal dryness and atrophy and new insights in its management. The reason I want to present this is we have in the past 1 year, we have a technology which can be used by women who are scared to use hormone replacement therapy. So vaginal dryness and atrophy is quite common in menopausal women, and also it's quite common in women who have been treated for breast cancer. And the breast cancer survivor patients invariably do not want to use any type of hormonal preparations. So what I'm saying is it's a big undisclosed problem, and especially so in breast cancer survivors. The common non-hormonal preparations or the counter medications are like Replenz or Hylofen. The problem is they need to be used quite often on a daily basis. They can be messy. They don't give complete symptom relief. So this is the our Monolith touch laser. So typically it is used in the outpatient environment. Patient will be counseled. The probe is inserted into the vagina. There are set protocols. The process and procedure takes less than 5 minutes. And none of my patients or others' patients ever experience any pain or discomfort during the treatment. Let's see whether this works. No, sorry about that. The new kid in the block is called as Deserial. So it's a French technology where women with vaginal dryness and atrophy, the hyaluronic acid, also called as HA, is injected with the insulin syringe at the introital level. The beauty of this is that once injected, the effect of the hyaluronic acid lasts between 6 to 9 months. So if you compare the Replenz, which women have to apply 3 to 4 times a day, on the contrary, if they decide to use Deserial, it's once every 6 to 9 months. The hormonal preparation, which works beautifully, is Vagifem or Ovestin. So Ovestin is available as a cream, and Vagifem is available as a pessary. I think that concludes my COVID-19 and the gynecology practice.